Hi everyone, Dr. Harmon here. Today I'd like to talk about the effects of Botox on the brow, specifically how to consider getting a non-surgical brow lift utilizing medications such as Botox. It's a common misconception that placing Botox in the forehead gives an individual brow lift. I'd like to explain why this is incorrect and how to think about the use of Botox for a brow lift, which is still an FDA off-label treatment for the face. Botox and other similar products act to reduce the movement of muscles in areas where they're injected. And so you have to think about how those muscles function when such medications are not injected. The forehead has one muscle that lifts the brow. There's no other muscle that lifts the brow. It's called the frontalis and extends across the forehead in a ribbon. Reducing the movement of muscle in the forehead, in effect, can actually drop the brow if placed too close to the brow. And so just placing Botox there does not have the effect of lifting the brow. However, there are multiple muscles that pull the brow down. On the side, that includes what's called the orbicularis oculi, which is a muscle that surrounds the eye in a circular shape. And so placing Botox in the crow's feet, and especially up closer to where the brow is, serves to reduce the pull down of the brow by reducing the effects of orbicularis oculi there. In between the eyebrows, there are multiple muscles that pull the medial brow down, including the procerus and the cordillera supercilii muscles. They're strong and they sit deep in that location. And this is another FDA-approved location in addition to crow's feet to place Botox. In reducing the pull of those muscles, you can in effect generate unopposed pull in the center of the eyebrow with the frontalis muscle. So if you imagine not placing Botox in the forehead, but placing Botox between the eyebrows and under the brow here and along the crow's feet, you can get a lift through the frontalis muscle while reducing the pull down from the muscles such as the two muscles between the brow and the orbicularis oculi in the lateral part of the brow. So it's in fact the opposite of what most people think about when they think about how Botox functions to lift the brow. And again, this is not always dramatic, and most people don't want a dramatic change with a non-surgical brow lift. It's also not a replacement for a surgical brow lift, which allows much more precision and long-lasting results. It's always important to have a good consultation with an experienced injector if you're considering treating the muscles in your face to get a brow lift. And it's important, in my opinion, to seek a fellowship-trained facial plastic surgeon for a consultation if you're considering a surgical treatment to get a more precise or longer-lasting